I was first diagnosed with scoliosis when I was a child. I don't know exactly what age, but I had been seen by doctors when I was younger, all the way through, I want to say high school, maybe 18, right before I went off to college, and it wasn't progressing, so we just kind of left it where it was.
One of the misconceptions that a lot of patients have, and they have it because of what they're told by their pediatric doctor when they stop growing as a result of scoliosis, that if they don't hit this surgical threshold, a lot of patients are told not to even worry about it. Like, don't do anything, don't even come back and check it. Like, it's like no big deal, like it just disappears, right? And unfortunately, that's not the truth. And it's one of the biggest mistakes that I see, because a lot of these pediatric doctors, they're pediatric surgeons, they don't deal with the adult patients. So why they're told not to worry about it, I don't know, but we do see progression, and this progression is a result of gravity over time and activity, and it can be trauma related. These things compounding causes the spine to compress. When this compression over time is what can lead to problems like pain, malfunction, and things that patients don't want to be experiencing as a result of their scoliosis, which would drives them to go back to have an evaluation done and see, oh no, my curve actually has progressed over these years.
I was diagnosed growing up with vocal cord dysfunction, and it always seemed a little strange. And at one point, I went to the doctor this year, and they took a chest x-ray, and they essentially said, you don't have that. It's really your spine curve is impacting your diaphragm, and that's what's causing some of the breathing issues that you have. And so I came into Dr. Tony, and he took more x-rays and said, oh, your curve is significantly larger than the 20 degrees that it was when we stopped seeing doctors, and that's what's impacting your diaphragm.
Scoliosis and breathing or cardiovascular function or respiratory function is this big unknown variable, meaning they used to believe that anytime the curve shifted to a certain degree, it will affect every single person to the same extent. Meaning if you had an X degree curve, you can have this amount of cardiovascular function, this malfunction, and this amount of respiratory function. We know now that's not true. It's individualistic, meaning a 4-degree curve in one person may have no effect, and a 4-degree curve in another person could possibly have an effect. The only way to really know is to examine that person. So yes, it's possible, but it's not possible for every person. It's very individualistic. For Amanda, this curve was starting to affect her respiration, was starting to affect the way it was breathing and the way she was actually functioning. And therefore, it was having an impact at a smaller curve size. It's not common for a 50-degree curve to have this type of effect on a patient, but for Amanda, it was, and it was causing it. So therefore, it was a real problem that had to be addressed.
My initial x-ray is at 52. We always were told that shortness of breath was brought on by stress and other activities like that. And essentially, there would be times, especially when I was starting my new job, where it was just like I couldn't shake the breathlessness. So I was like, let me just go get this checked out. And that led to the x-rays, and here we are.
When we look at scoliosis and how it could possibly affect this breathing capacity, respiration issue, it's more likely a multifactorial causation. Now, most of the time, these respiration issues, if there is one, are within somebody's normal function, meaning they don't even know they have them because nobody uses 100% of their respiration, like they're only using a percentage of it. But if it can affect it to a certain point, it can start affecting her daily life like it was with Amanda. That's why reducing the curve, getting it as straight as possible, improving flexibility of the spine, doing all the things that we do to help rehabilitate this problem so it doesn't continue to worsen, is going to allow her to live the most functional life.
We took x-rays at the beginning of this week, and it was down to about 45 degrees after a month of home care. And then after this week, the x-rays are down to about 41. And then from here, we go into 90 days of just the home treatment. And I think part of it's mental too, just knowing that the issue's being fixed. I don't have to worry about stress as much as being a factor towards triggering it, so that definitely helps. It's really reassuring to know that there's a solution for this problem without needing surgery, because back surgery is very invasive, and I don't always know that that's the right option, especially for someone like me who's so active. That would put me out for a long time and probably never get back to the level of activity that I currently do. And just knowing that the staff here believes that it can be fixed is really reassuring. I definitely would hope to reduce more if possible. I know where my curve is, that might not always be possible, but at least maintain where I'm at, because the progress, even in just the 2-week intensive, is amazing.